provides to inner developers so that they can learn how to implement these approaches in their communities. And that is not an exhaustive list of interventions. It does not have all of the potential interventions that would be applicable to populations in these 4 areas. Note adding to the registry suggests endorsement for the effectiveness of the intervention. Out about NREP, and in particular about the conference that they held recently. The first of its kind. Attempt to build on the principle of relevance. That intervention should be relevant and meaningful to the targeted population. The conference also welcomed an open discussion of the question, how to establish partnerships to design evidence-based interventions that are culturally relevant and have maximum effectiveness it intends to help. We encourage all of the participants today to the NREP website. Look at some of those options there. We'll take a brief look at the website, just a few familiarize you with options available. It's difficult to see, and I apologize for that. But what I did is I took a picture of the page that allows for the selection of prizes. And if you can see this, it allows for selections of gender areas. Again, the 4 areas: mental health promotion, mental health treatment, substance abuse prevention, substance abuse treatment. It's for the identification of alcohol, cost, crime, delinquency, drugs, all of the outcome categories that you may be interested in. It's a lot more than what's pictured on your screen. I would encourage you to go to this site and to look at using this for your population. What it will do is it will go to data set and look the evidence-based practices that fit what you're looking for. As on the next slide. Here we have 3 programs that were identified to fit the Native American population, define American Indian, Alaskan Native. And we'll go into select evidence-based practices on NREP. Is the option in the target population whereby more than 50% of that population was studied with that intervention. I urge you to select that, because if you don't select the 50% or greater, then what we find is that it will come back saying it's appropriate for a special population, when in fact there may be very, very few in the population that was studied with the intervention. Here I selected, I was at Native American, again American Indian, Alaskan Native, and I went for prevention. Families and schools together, we have Project Venture, and we have the wellness school curriculum. With these, you can select and all detail regarding these. You'll identify detail, the quality of research, the risk for dissemination, and it's attached with implementation, and to identify any replications. And they'll discuss the replications and findings. Perhaps most important is there's always contact information of the actual program developer for the intervention. So it's Mac Hall's Project Venture, or Teresa LaFambeau's American Life Skills, which are both Native American programs. They give you the contact information, and I encourage you, if you're interested in those programs, to contact the developer and to about the application within your communities. And to find that the costs are perhaps on the resources that your particular thing has, I would encourage you to call up the developer anyway and talk about that, because some of the developers work off of a sliding scale. And if there are no resources for the intervention, I will encourage you to to call them, because other developers are looking for settings to rate the effectiveness of their program. The site is one of several sites that are out there. And at the end of today's presentation on my slides, I've listed some others for you to go to. But I encourage you to take a look at these and again, pay particular attention to the sensitive components within those interventions. Into the online registry that and in addition to the conference that it provided, where it put more than 70 Native American and evaluators together to address the indigenous of local practices. There's a solution that deals more with policy, and that's what we have in front of us now with the state of Oregon. Oregon has been a leader in the country in terms of assessing local-based, practice-based evidence from work with tribal leaders in the state of Oregon. There, it's from Jason Yarmer, who was in the state of Oregon. Confident and culturally validated programs not be discounted because the dominant culture has not included those programs in its evaluations or has been incapable of conducting a culturally competent evaluation. There is a call for culturally informed evidence-based practices. And it's an acknowledgement of the value of culture in effective interventions. Oregon has been one of the leader states in this country to help translate research into culture-informed interventions, recognizing the effectiveness of traditional practices that may have been passed down from one generation to another. This slide provides some of the history, gives some chronological perspective of how long it took in the state of Oregon. And in 2011, with policy that authorizes evidence-based programs and tribal-based programs. Senate 770 began 2001. Relationship with 9 recognized tribes and the state of Oregon to address the topic. 2003 created a mandate requiring that programs using funding for behavioral health should the implementation of evidence-based practices 2% to 75% of funding. In a significant paper that was written by Caroline Cruz and Dr. John Spence, it developed the formation of the Oregon Tribal Best Practices. All information, including J contact information, will be on your resource slides at the end of this presentation. Some of the quotations from the actual policy. The Addiction and Mental Health Division does not believe that an evidence-based practice from the list should be assumed to be better than a culturally validated practice unless the assumption is supported by scientific evidence. I won't read the second paragraph. I'll let you do that. But please note the recognition and acknowledgement of the importance of culture in outcomes. The reference to practice-based evidence. Evidence is another term for evidence-based practices that are derived from local practices that are developed from evaluation designs and represent a good fit with the community because they're grounded in the community. Culturally appropriate applications in the community meet the people where they live. Typical practice-based evidence are embraced by the community because of that fit. Better for engaging community members in responding to their needs and vision. It's important as if the community embraces a particular intervention and relates to the outcome, the community support for that particular intervention will continue the community's awareness of the issue. It's for engaging community members in reflecting their theory of change, describing outcomes, indicators of change. It'll allow the community to highlight the issue and to highlight the success that the intervention has been successful in addressing the problem. For engaging community members, developing appropriate evaluation methods in tribal communities is not something typically been embraced within the community from a centric definition of evaluation. The community members to increase their understanding of evaluation, embrace it in a participatory role to community members. Lastly, best fit for engaging community members in interpreting and reporting the results. Back to some of the components of what evidence-based practices are, and referring back to the talking circle, this allows the community members to not only on the intervention, but to focus on the outcomes, and as a feedback loop. So the improvements that are due to that particular intervention will also be grounded in the community. Spelling and participation in crafts can be important also in establishing trust with the Native families. These are also practice-based evidence. We know that many times local practices can be more effective classrooms, for example, with storytelling. That may be more effective establishing trust than within a 50-minute office visit, as an example. Culture involves identification with the land and distance, and allows for increased self-esteem. Many Native practices that embrace the cultural identity in individuals to develop their own from the issues that brought them to a particular state. Ceremonies, many times passed on from generation, can also teach self-discipline to children. So these are some of the practice-based evidence that result in significant client outcomes, are improvements over more Eurocentric interventions. This is of some practice-based evidence. Canoe journey, culture, sledge, cradle boards, powers, American horsemanship. Some that have been mentioned in the state of Oregon, reference to Jason Yarmer. There are many other practice-based evidence models out there. To the issue of evidence-based practice in tribal communities is the addition of requiring cultural competence within the development of evidence-based practices. Ethnicity and cultural group make this a requirement in some of your interventions. Evidence-based practices for specific ethnic and cultural groups. Expand the definition of evidence to include culture-specific interventions as done in the ground. In conclusion, a variety of forces are shaping discussions across the country regarding the optimal approaches to the quality of behavioral health services for Indian and Alaska Native programs. While in some successful efforts to blend traditional and Western practices, some American Indian and Alaskan natives remain uncomfortable with the depth of Euro-American approaches to treatment in their communities. Of cultural competence in service delivery systems through best practices in the workforce have shown significant positive outcomes. This slide, the provision of cultural competence results in improved health outcomes. I hope I was able to address some of the challenges tribal communities to some of the requirements for evidence-based practices that are by funding agencies. And I hope that today I was able to show evidence does exist in tribal communities and has for centuries. It's really the definition, the root to the problem, the definition of evidence. There's in terms of what proved outcomes are. So perhaps as we continue to evolve, the effectiveness of evidence-based practices and the inclusion of cultural competence, perhaps there will be more blending in time. But it's important that there be recognition of what's effective both at the local level, professional practices, and tribal elders' wisdom from some of the clinical research that NIDA and others. A blending of these with our advantage. I can take at this point.
Great. Thank you so very much, AJ. We're doing our Q&A in just 1 minute, but I wanted to share a little bit of information about the Consensus Project in general. Just a reminder that if you have any questions for Dr. Ernst, please type them into your Q&A box in the bottom right-hand corner of your screen. Criminal Justice Mental Health Consensus Project, coordinated by the Council of State Governments Justice Center, is an unprecedented national effort to help local, state, and federal policymakers and criminal justice and mental health professionals improve the response to people with mental illnesses who come into contact with the criminal justice system. Since the publication of the landmark Consensus Project report in 2002, written by Justice Center staff and representatives of the leading criminal justice fields, CP staff have been working support of and implementation of practical, flexible criminal justice mental health strategies through on-site technical assistance, the dissemination of information about programs, research, and policy developments in the field, continued development of policy recommendations, and educational presentations. In partnership with the Department of Justice and the Bureau of Justice Assistance, we have created 11 national learning sites, 5 mental health court sites, and 6 law enforcement jurisdictions, and have one of the largest interactive and fully searchable online databases of collaborative criminal justice mental health programs from across the country, in addition to a number of specialized publications in courts, corrections, law enforcement, and other mental health topics. You sign up for our monthly newsletter at our website in the upper right-hand corner, consensusproject.org. We're going to begin the Q&A session, and I will moderate any questions that are coming in from the audience. We will do our best to answer as many questions as possible in the time remaining. We'll also be hosting an online forum of this topic and encourage you to post your remaining questions to that discussion. You'll find the address to that on your screen right now, and notify all registrants when the forum is live. Okay, so we had a few questions that have come in. AJ, first one, I'm going to type into the chat window so everyone can see, is we do not have a very large Native American community in our jurisdiction, but would like to be sensitive to everyone's needs. We also do not have a relationship with anyone from the tribe, but do treat tribal members. Do you have suggestions on how to initiate these conversations?
Great question, because there are many different options available. It all depends. I know that at the state there are NPNs, National Prevention Network coordinators, whose sole purpose is to be responsible for the prevention services in that state. And for those individuals that are not interested in substance abuse prevention, what we about this is that the NPNs oftentimes have direct contact with tribal members, and they have committees. Most of the time, what's necessary is to establish a link, perhaps someone who knows a tribal member, if you have a direct contact. May be one solution. And again, every state has a National Prevention Network coordinator, and that'd be through the state Substance Abuse Authority. The other avenue is many of the tribes have websites. So you go online, if you know the particular tribe's name, you can go online and look at their website and look for contact information there. The best way, however, is face-to-face. And that is to go to the particular reservation, or if in an urban setting, you're not going to contact, but to set up a face-to-face. Because what's most important culturally for Native Americans is to be able to develop that relationship and identity, a face identity, to build a relationship with. You don't go very far in establishing relationships with Native communities if everything is electronic, everything is email, or even on the phone. So face relationships are key. The other thing, there are employment opportunities. If you staff positions that are open, and it makes sense to bring in a Native American to that position, because the primary responsibility of that position would be to establish relationships with Native Americans. That's an avenue I would consider.
Great. Okay, we have another question. Since there's little empirical evidence on how the evidence-based practices work in our communities, do you suggest that we start collecting data on how the EBPs work? Are there particular areas we should emphasize, and should we partner with an outside evaluator, an agency, or a university, or should we try and do it on our own?
Thank you, Cynthia. Evaluators are definitely valuable and used. I would use caution, however, because if you're using outside evaluators in tribal community, you want to make sure that the evaluator is experienced in that population. If you're for outside evaluators to assist with data gathering, data collection, partnering with an agency is always a good choice, because the university will oftentimes have funding or have some attached funding that might be to support those efforts. The university also has some incentive for developing its papers and developing research, and if you can fit and match your particular needs with their needs, obviously that will lead to both of your advantage. But doing it on your own, I'm really caution against doing it on your own unless you have an evaluator or people experience with evaluation. Best practices, an opportunity of improvement, but there are details in terms of its implementation that are necessary. The evaluation piece, the outcomes, all the outcomes that we spoke about today on the slides are necessary to really link together. So unless you have the experience within your setting, I would look at evaluation, I would look at university involvement. Also talk to other agencies similar to yourselves. The most valuable piece of information comes from lessons learned from others who have been there and done that. So you can find other agencies or settings that have embraced particular evidence-based practice, even if it's not the same one that you've selected, but links to evaluators in the process, that would be a real benefit to you.
That's terrific. Another question. We are a treatment facility that often sees people that are tribal members, but we don't have specific EBPs that are geared towards their tradition. What are suggestions on where to start? And like everyone else, we have a limited budget and staff time.
That's a question, Cynthia, and I'm taking my time with the answer because I realize that there are the majority of treatment facilities do have the control evidence-based practices to address the needs of clients who are native that may be utilizing those services. Also know that a vast majority of treatment providers do not employ native individuals who can serve as the provider for others coming in for that service. So I would say in terms of what to do, well, I want to take a look at several things. The first is to take a look at the capacity for bringing in Native Americans into the agency as professionals, to see if there is a way for you to connect with the Native Americans, providing perhaps internships at your setting. What you do is you're trying to establish linkages with the Native communities in your particular area, and you build up the professional capacity of them to assist your needs and work directly with the Native population. As we know, is extremely effective, and is particularly effective Native to Native American in terms of recovery efforts. If not possible, if there's no capacity to increase the professional capacity specific to Native Americans, then bring in somebody obviously that can provide some culture-sensitive approaches and trainings to your staff. It's important in that aspect because otherwise, without that cultural component, may affect negatively the outcomes for that particular client. At this point, I'd like to mention a particular resource that I think would be valuable to individuals who may not be familiar with this. It's called the Culture Card, to build cultural awareness with American Indian and Alaskan Natives. This is a resource that provides the do's and don'ts and called protocol for anyone working Native Americans. And I strongly encourage everyone to get this resource. It's free. In fact, you can ask for a shipment of 50 of these. They fit in your pocket from AMSA. And I have one in front of me now. I'm going to read the phone number for people to call. And I would encourage you to take a look at this. You can order 1 or 50. 1-877-726-4727. 1-877-726-4727. Again, it is Culture Card, a guide to blend to build cultural awareness for American Indian and Alaskan Natives.
And Mariana has just put a link to the card in your chat window as well. And I'd also like to just echo for AJ, I'm holding a copy of the Culture Card in my hand as well, and AJ recently gave me a copy. I found it really helpful when I was working with or delivering technical assistance to different tribal communities in my work. So I thought it was a really excellent resource, and I think that AJ already knows that it's something that I really found useful and helpful too. Here is another question that's come in, and I'd like to just call attention to the time that if anybody has any additional questions, we have about time to take just a few more. Please go ahead and type any questions in your chat window in the bottom right-hand corner. Okay, next question. Are specific EBPs on NRAP that have good outcomes for our communities?
Again, if you're looking for mental health promotion, mental health treatment, substance abuse prevention, you look for currently health treatment or substance abuse treatment, you're not going to find those there that have been targeted to 2% or more of the Indian Alaskan Native population. If you're looking for substance abuse prevention or mental health promotion, you will find some of those models. The standout for substance abuse prevention include American Life Skills by Teresa LaFambeau, Families and Schools Together, Project Venture. Some of theirs include for mental health, Red Cliff Wellness, model adolescent suicide prevention. All of these are within the NREF site. But also encourage you to go to the One Sky site, which is on my slide as well. One Sky is an organization really led by Dr. Dale Walker, and we have for years the issue of traditional practices and the evidence within those practices. There's a great deal of material there. Hawk also explored a lot of practice at the low level from communities. She is so an excellent resource for you as well.
Terrific. I particularly like this next question. I think this is a great question. We include indigenous knowledge in our programming. Should we be measuring outcomes differently?
Good question. I appreciate that. The answer is no, because it has to be grounded within the target population. So if you include indigenous knowledge in your program, what is the purpose of the knowledge? What is the intervention and outcome specific to that particular knowledge? You may want to take a look at whether individuals embrace a particular culture. So take a look at the instrumentation that allows for that to happen, and it's out there. But it does so much that you do want to pay attention to the cultural aspect of it, but you're going to have to dig into the question to see what the purpose is of that particular intervention and look at some of the instrumentation out there that would help you measure it.
Terrific. I'm going to ask one more, and then I think we are done. We choose to include indigenous knowledge in our programming. Should we be modifying our screening and assessment tools?
Question. But ties back to the purpose of the intervention. That the indigenous knowledge in the programming is to provide for increased cultural embrace in terms of their connection to the population. That indigenous knowledge has aspects that will help the individual in whatever aspects of recovery that they're coming there for. All of those need to be identified. It's really the challenge of evaluation, and that's the challenge of program developers with evidence-based practices, because there's no clear-cut effect much as science, some of the scientists would like there to be. Project Venture, as an example. Project Venture works with high-risk youth. They put through skills tests, develop their confidence and their self-esteem, and they, until recently, never paid attention to the effectiveness of the Project Venture model on suicide. And they've looked at this connection over time. They've looked at some of the participants, which is youth, and later followed up with those same participants and saw that there was a very positive impact. The individuals carried through. Not only was there very little suicide involvement, suicide ideation, but there was improvement in other areas in terms of academics, in terms of engagement in the community, the responsibilities in many different roles of that particular community. Important to understand, again, what that particular intervention, and again I'm referring to indigenous knowledge as an intervention. It serves a vital purpose, but it's important to really dig into, well, the purpose of this and how do we measure the success in terms of the outcome. Because we're paying attention to the purpose. Just as expression as any road, if you don't know where you're going, any road will get you there. Make sure that the intervention serves a purpose and you're able to capture the outcome and improve it over time.
Great. Terrific. And just before I conclude, I just wanted to point to the chat window that a participant has mentioned some of the things they have done to help engagement with the Native American communities in their area. So if you haven't seen that comment, I would direct everyone to the chat window. Thank you so much, AJ. This has been wonderful. This concludes our webinar today on evidence-based practices in tribal communities, challenges and solutions. Thank you all for your attendance and participation, and thank you to the Bureau of Justice Assistance for sponsoring this event. And of course, a big thank you to our presenter, Dr. Ernst. A recording of this presentation will be available online next week at our website, www.consensusproject.org. And finally, when you leave this event, a brief survey on this webinar will pop up on your screen, and we would very much appreciate your feedback. Thank you, and we hope to see you again soon.
I'm going to pull us into a practice room.